According to Cancer.org, in an article published in 2017, colorectal cancer is the second leading cause of cancer deaths among men and women combined in the United States. I think a lot of us have the attitude of cancer can't happen to us or it won't happen to our loved ones, especially at a young age. But unfortunately, cancer doesn't discriminate. It's becoming more and more common in the younger generation, and it's fatal if not caught early. By obtaining a colonoscopy by the age of 45, you're significantly reducing your risk of colon cancer. It allows the cancer to be caught early and is the most accurate form of colon cancer screening. This is something that I'm really familiar with. I am an endoscopy technician, which means that I assist in the procedures of colonoscopies and things like that. I've seen numerous cases that a young patient coming in hoping to catch things quickly. However, that's not always the case. Sometimes there is a worst case scenario and you wind up with someone under 50, which is the recommended age for a colonoscopy, who is now being diagnosed with late stage colon cancer. So through this speech, we'll talk about a couple things. We'll talk about the process of colonoscopies and the demographics of people that are mostly affected by colon and rectal cancer. We'll talk about the risk of colon cancer and the growing numbers, and then we'll talk about ways to prevent colon cancer and alternatives to colonoscopies. So one of the reasons I think that people aren't getting these colonoscopies is because of the stigma and the taboo surrounding them. So I'm going to try to break that down a little bit. Colonoscopies are not what everybody thinks that they are. I think sometimes people can be nervous because they know, the area that we're talking about, it's something that's not generally discussed when you go in for a physical all the time until you reach the age of 50. So with that, we'll talk a little bit about what a colonoscopy really is. So you're going to be sedated. You're not going to be awake. You're not going to remember anything. So after anesthesia puts you under, you're not going to feel anything. They're going to go in through your rectum. They're going to go up here through the descending colon, across the transverse colon, and down the ascending colon to the cecum. This process takes not a lot of time to get in, and then when they are coming out is when we're looking for things. So that takes at least 6 minutes. That's a regulation. It has to take 6 minutes to go from cecum to coming out. The goal of a colonoscopy is to find these polyps. Polyps are precancerous, almost like little tumors. So when we're removing them at this stage, they're not cancer. You want them gone at this stage. So we use a biopsy, we take it out, we send it to the lab, typically not cancerous. The goal is to catch polyps and not catch colorectal cancer. So with that, according to the Colorectal Cancer Alliance, colon and rectal cancer incidence and mortality is highest in African Americans. In fact, between 2019 and 2013, African Americans were diagnosed 20% higher than Caucasians, and deaths were 40% higher. The scariest statistic that the Colorectal Cancer Alliance put out in 2017 is that cases in people under 50 have increased from 6% to 11%. 72% of those cases occur in people in their 40s, which is under 50, which is the recommended age for a colonoscopy. So why? Why is this happening? Why are people being diagnosed and dying from colorectal cancer at such a young age? Well, according to an article from fightcolorectalcancer.org in 2017, it's attributed to lack of access in healthcare and lack of education in young patients and doctors. People aren't recognizing the signs and symptoms in patients that are under 50 because it's not something that we typically talk about. We don't talk about people in their 20s being diagnosed with colorectal cancer, but it does happen. This is important because according to an article published by Colorectal Facts and Cancer Figures in 2018, the median age of early diagnosis is 44 years old. A study released by NIH found that most patients under 50 experience signs and symptoms, but they don't know what to report. They don't know what's abnormal. So what are the signs? According to the Mayo Clinic, you're going to be looking for a change in bowel habits. You're going to look for rectal bleeding or blood in your stool, persistent discomfort, or a feeling that you're not completely empty and you may feel like you still have to go. Of course, weakness and fatigue as well is something that's typically contributed to things like that as well. However, the scary part is many people show no symptoms that early. So we're wanting people to get checked at 50, and we're telling them the signs and symptoms, but if you're not showing the symptoms and you're not getting screened before 50, you may be developing cancer and not even know it. So the most common cause for the rise in colorectal cancer in the younger generation is improper screening routines. In fact, 1 in every 3 people are not up to date with a screening for colorectal cancer. According to cancer.org, 60% of colorectal deaths can in fact be prevented by routine screenings. So that's why it's really important to make sure that you're getting screened at an early age. We don't want you getting screened at 50 years old when right now the median age of diagnosis is 44. And although there are alternatives to colonoscopies, it's still the most accurate. The most common alternative is a fecal immunochemical test, which uses antibodies to detect blood in your stool. So an example of this, of course, you can go to a lab and get it done, but I think we've all recently seen the commercials for Cologuard, where you just, you go in a box and then you send it in and they test it. However, if anything comes back abnormal in that test, you still go in for a colonoscopy. Colonoscopy is the most accurate. A doctor is looking at it live action to diagnose you, and then we're going to take the things out that lead to cancer. So first, we talked about the people that can be affected, as well as really going in depth with what that procedure truly is. So hopefully it's not as scary anymore. And then next we talked about the statistics surrounding the early onset of colon cancer. And finally, we discussed how you can lower your chances of getting colon cancer, even if you are still nervous of a colonoscopy. There are other options for you to at least detect abnormalities. So by obtaining that colonoscopy by the age of 45, it significantly lowers your risk of colon cancer. It allows cancer to be caught early, and a colonoscopy truly is the most accurate form of colon cancer screening. In conclusion, getting a routine colon cancer screening done by the age of 45 instead of 50, because remember, our median diagnosis age right now is 44, you can decrease your risk of colon cancer by up to 60%. 1 day of your life. 1 day. It takes 1 day to get a colonoscopy. That 1 day could save your life. Call your doctor, make an appointment. It can mean the difference between sitting down at Christmas time with your family or next year your family having to visit your grave on Thanksgiving instead. Get screened. Thank you.